severe. Let's explore some of these modern surgical techniques to control weight problems and visit the offices of Dr. Vincent Hamilton. It's nice to see that Dr. Hamilton's office is so close to Fremont Hospital. I'm sure as a general surgeon you have to get back and forth very quickly to Fremont. This gives you that convenience.
Yes, it's definitely an advantage.
I always like to begin by having my guests tell us about their educational background and training. Where did you go to school?
Well, I grew up here in Yuba City, and after graduating from the high school, went to Tulane University in New Orleans. I graduated with a Bachelor of Science in biology and a minor in chemistry, and went to the University of Tennessee Medical School in Memphis. I graduated there in December of '71, and then did a cardiology fellowship for about 5 months.
Not too many surgeons with a cardiology background like that.
Well, it was the only department that would pay me. I had to wait for my wife to finish nursing school.
Ah, good reason. Very good reason. That's interesting. Having grown up in Yuba City, there aren't too many doctors in our community who actually grew up here. Isn't that true?
I don't think there are any other ones. At least,
it's interesting. It really is. And then you went all the way to the East Coast, and here you are back again.
Right.
After medical school, what happened?
Then I went to the Medical College of Virginia in Richmond and did a rotating surgery internship and then 4 years of a general surgery residency.
And that's the main residency that allows you to become board certified in surgery.
Right.
Is that correct?
Right.
Great. Now, I know that your family has been involved in medicine in this community for many years. Could you tell us a little about the history of the Hamilton family?
My uncle Lucian, another general practitioner, came here in 1932, and then my father came in 1947. That's Dr. James Hamilton.
Great. I've met him. A very nice person.
He's not bad.
And there really is a Hamilton dynasty going on here almost. Not really. But it's a very good medical family, and everyone's always had top training. Then everyone always gets confused with all the other Hamilton doctors in this community, too, but you're not all related.
No, my dad and I are the only two
actively here that are related right now.
Right, there are 4 Dr. Hamiltons.
That's amazing. Now, you've devoted a lot of time to working in hospital committees as well. What are some of these things that you've done?
Well, when Sutter County Hospital was still functioning, I was on the medical audit committee out there for several years. I was chief of staff in 1980, and
you've served on some of the committees here at Fremont as well, isn't that
right? Right. I've been on the utilization review committee and the audit committee and the pharmacy and therapies committee I've been chairman of. And
when were you head of the Department of Surgery?
I am now.
Oh, you are now. Very good. Great. Great. Well, I don't know how you do all these things. Let's get more into the actual field of surgery. As a general surgeon, in the operating room, what kinds of things do you do as general and vascular surgery? What does that mean?
It means repairing hernias, taking out gallbladders, operating for ulcers, taking out, doing gastrectomies, surgery on the stomach or the large or small intestine, or cleaning out, with the vascular, it'd be cleaning out blood vessels, whether they're in the neck or in the abdomen or in the legs.
When people get these blockages in their neck arteries, you're able to repair that with surgery?
Right, you go in and clean it out.
Well, now we'll switch to our real main topic. This is the topic of controlling overweight problems with surgery. What do you recommend to patients when they come to you asking about control of their weight when they're only maybe 20 to 50 pounds overweight? Certainly surgery is not the answer there.
No, not at all. I would encourage them. Usually I have some sort of a diet sheet, such as a 1,000-calorie diet. Encourage them to follow that, and then usually let their regular family physician control and oversee the diet.
Right. So you don't have them go out to any of these special diet programs in the community?
No, there certainly are several around, and I just know of their existence.
Well, how do you decide when a patient needs surgery to control obesity?
Well, a person has to be at least 100 pounds over his mean ideal weight, or greater than 30% of what his mean ideal weight is, because when they're beyond 30%, that's when the morbidity and mortality start to become significantly significant.
So when
statistically significant.
When they get that heavy, they actually have health problems from that.
Well, no question about it. They actually will increase young people, as in 20s to 40s, will actually increase their mortality 12 times by being markedly obese.
So what are some of the health problems that can happen when someone's 100 or 150 pounds overweight? What happens to them?
Well, their diabetes will either be exacerbated or come to the forefront if they were borderline. Oftentimes they're hypertensive.
So blood pressure goes up and they
Right.
can get strokes and things like that.
Right, and more complications. They're more likely to have heart attacks or strokes because of that. And because it's literally doing more physical work and just moving around.
So when people are that heavy, you're actually, by doing the surgery, prolonging their lives.
Right, that's the whole idea.
Great. When I was in medical school, I remember watching surgeons doing a procedure called a bypass, an intestinal bypass. I noticed you have a diagram that perhaps you could show us in that book that shows what's meant by a bypass. Could you?
Right, I got a diagram here that gives some idea of what it is. The intestinal bypass means that you're bypassing most of the small intestine. You pick a point beyond what we call the ligament of Treitz, which is where the small intestines start, and go about 12 to 14 inches beyond, and then you divide the intestine at that point and go somewhere between 6 inches and 12 inches from where it joins the large intestine, and you exclude that part of the small bowel.
So after the food enters the stomach here, it doesn't have all that intestine to go through.
Right, it's actually short-circuited.
So the food goes in one end and out the other? Basically?
Exactly. You're guaranteed diarrhea.
Oh, that's miserable. Whatever happened with that procedure?
It had enough complications where it came to the point where almost 2/3 of the people who had the operation had some sort of a significant complication, including fatty infiltration of the liver, which could be life-threatening, and therefore it had to be reversed.
So surgeons would actually have to go back in and put it back together?
Right.
Putting a hose back together so it worked like it used to work?
Exactly.
Did it correct itself after
Yeah.
that? I even read, I think, about some skin diseases that came about from bypass surgery, which was interesting when I was doing my training.
All sorts of unusual things came about. People with paresthesias, low zinc, low magnesium, and not counting the increased incidence of gallstones, kidney stones, arthritis, arthralgias.
So nowadays there are some newer procedures, and I guess one of them is called a gastroplasty?
Right.
What does that mean?
Gastroplasty means that you are dividing the stomach using a stapler and making a smaller pouch.
Do you have some pictures that you can show us of this, too?
Yes, I do.